Regarding orthotic, they are externally applied appliances which augment and improve function. Regarding a functional, it is number one, correct deformity as TLSO and AFO, limits motion like knee orthosis limiting hyperextension, assist movements like HKFO in myelomeningocele, support, for example, polio, or spread load for discomfort. Ideal characteristics, function, it should be mechanically sound and durable. Number 2, cosmesis. Number 3, acceptable. Should be cheap, adjustable, and easy to use. While talking about the material used, they are thermosetting, thermoforming, and self-generating polyurethane foam. Thermosetting needs a high temperature and required to mold and difficult to fabricate. They are durable prostheses and undergo greater stress. Then is thermoforming. Thermoforming are 3 types: high temperature, moderate temperature, low temperature. The lower temperature one can be warm in cold water and manipulated, and they are less rigid. Then is self-generating polyurethane foam. These can allow shaping on the patient and hardens after application, like corset and brace. There are molded cushions for the wheelchair is also there. Similarly, there are old-fashioned like plaster, rubber, or metals. Regarding the classification, it can be static or dynamic. It can be correctable or accommodative. Regarding the biomechanics, every force body has external forces which are negated by internal forces. Static are the ligaments, dynamic in the form of muscles. So the pathology reduce the internal forces and orthotic control those external forces. So there are different types, direct and indirect. In the direct, there are three types: 3-point fixation, 4-point fixation, load sharing. In the direct one, we're talking about the 3-point fixation. It controls movements around the joint line. For example, MCL injury, you need a 3-point fixation: 1 point above the joint and 1 point above the joint, 1 below, and 1 at the joint. This allows sagittal movement stability. 4-point fixation control the translation. These are, for example, ACL deficient knee. And the third one is controlling axial forces or load sharing device, like an arthritic hip. An indirect form is which controls the line of action of GRF, like lateral heel wedges in varus knee, redirect the knee joint reaction for medial to the intercondylar rotch. Similarly, Grafo is one of an indirect control motion device which manipulates the joint reaction force itself. Talking about the common type of orthosis, foot orthosis, which can be corrective or accommodative. This can be insoles, like off-the-shelf fabricated one, total contact, which is made of imprint of the patient foot, or functional. When functional deformity, insole correct the deformity. They can be part of the shoes. That can be heels or soles. In the heels, these are externally applied basically. The heels are cushioned and resist eversion or inversion. Soles are like rocker bars or metatarsal bar or wedges or flares. The internal heel type is UCBL, which is University of California and Berkeley laboratory insert, used to control hindfoot valgus and midfoot pronation, and basically made of polypropylene. Then you have metatarsal pads and arch supports. Regarding ankle foot orthosis, this is used to prevent or correct deformity and reduce weight bearing. This concept is ankle position affects the knee stability. These are shown to reduce energy cost in ambulation in CP post-polio. There are different types of it. For example, solid AFO, hinge AFO, grapho, or trafo. Then we comes to knee ankle foot orthosis. So the orthosis is extended till the knee level. And then there is a trunk hip knee ankle foot orthosis, which is extended till the spine. Then we have some special type of them, like weight bearing orthosis, like PTBO for diabetic ulcers. We can have hip orthosis like a pelvic harness. Regarding complications, it can be psychological complication and physical complication. Psychosocial complication is because of anxiety and the reaction. The physical can be compression phenomena, heat and water retention, bony prominences being impinging. For avoidance, you should have a good contour, good mechanical design, and reduce shearing and adequate padding. When describing orthosis, talk about the components, talk about corrective or accommodative, static or dynamic, and material which is used. Grapho is a special type of orthosis. It is formed by a toe plate and a rigid ankle in neutral position and a rigid anterior tibial shell. This provides knee support to patient with weak quads and gastrosoleus muscle. It provides an extension moment arc at the knee as the joint reaction force passes anterior to the knee when the knee is fixed in plantar flexion. So it prevents forward tibial progression and knee collapse. By fixing the ankle into one position, plantar flexion, dorsiflexion, you can change the position of ground reaction force, either anterior or posterior, and encourage flexion or extension mechanism. Similarly, we have a functional bracing that is called Sarmento. This is a technique where a rigid immobilization is applied for the fracture of the long bones. Sarmento believes that rigid immobilization of a fracture of long bones is unphysiological, and then the movement and continued function encourage osteogenesis, and that continued function with the fracture is encourages intermittent loading of the fracture site by muscle activity, and it promotes local blood flow. The principle is to stabilize the fracture while allowing weight bearing and joint movements. Motion at the fracture site is prevented through circumflexion compression of the soft tissues. The example is PTB, a triangle shape proximally to cover the medial tibial flare and patellar tendon. Then another form of is UCBL, University of California Biomechanical Laboratory Brace. It is a rigid plaster insert that is fabricated over the cast of the foot with rigid and high posterior, medial, and lateral walls to provide a deep cut. It's usually used to control severe hindfoot valgus and midfoot pronation. This can be used in adult flat foot deformity, PT, posterior tibial tendon deficiency, flexible plasticus, and plantar fasciitis.